Upper trap spasms are the number one thing that we treat. And often, along with the upper trap, patients usually have shoulder blade discomfort and even shoulder pain. And they usually think that they have a shoulder injury. Well, today, we're going to go over that the symptoms are usually coming from your neck and give you a couple quick exercises so you can get relief now. More and more of us are working from home, and our home office is now either the kitchen table or even our couch. Not the best ergonomically. And we work at our computer. Often we find ourselves in positions like this after a while. And this is the number one position that does lead to upper trap and scapular pain and muscle spasms. As a clinician, the most important thing for me to do with a patient that has pain and is in this position is to simply educate them to get out of that position. And when we're treating a joint, the first thing we do is look at the motion, any pain or loss in motion when they move the joint. So when I assess a patient with neck problems, we look at their motion bending down or flexion, bringing their head forward, protraction, retraction, rotation to both sides, side bending to both sides, and finally, extension. The motions that are usually painful and reduced are retraction and extension. We start to lose those motions because we spend so much time in the opposite positions. And unless we stretch the opposite way, we start to lose it. So the exercise for those with upper trap and scapular pain is to do the exact opposite motions, or the motions we don't do that much of. So we find ourselves like this. We want to do retraction, pressure on, pressure off. So you start by looking at something straight ahead and try to bring your eyes back into your head. Pressure on, and then relax, pressure off. 10 times. After 10 of them, you want to sit up nice and straight and then do extension. Extension is looking up to the ceiling. Pressure on, tuck back in, pressure off. Pressure on, retract, pressure off to a count of 10. After you've done these exercises, you want to go back and check your baseline motions for any change in pain or range of motion. So we go back and check our ability to bend forward, protract, retract, rotate, side bend, and extend. If this is the proper exercise, you're going to see an improvement in those motions. If you do not see an improvement in those motions, or there is more of a loss in any of those motions, stop this exercise immediately and contact one of our clinicians. So remember, your body has the greatest ability to heal. All we need to do is put it in the right environment and reduce the stress.